My name is Wycliffe Matini from Ministry of Health, Kenya. I am coordinating risk communication.
Thank you for taking time to speak with us this afternoon. It's great to have you here in Kingston, Jamaica. Tell us a little bit about what brings you to the conference.
Well, thank you so much. I came to this conference because I am a member of the National Crisis Committee. This is a committee which was formed prior to the COVID-19 pandemic in the year 2020. And this was formed in Nairobi as part of the Global Tourism Resilience Crisis Management Center for East Africa. So I am coming as a facilitator to make a presentation on pandemics and epidemics resilience, especially affecting the tourism industry in the perspective of the health sector. Thank you.
And could you share with us a little bit about sort of what we've learned from the pandemics when it comes to tourism resilience, particularly in the hotel sector?
Yeah, we have taken note that pandemics and epidemics are things to be with us. It's part of us, and going to the future, we are not seeing a space whereby we shall live without these pandemics. So the major, and what we have learned since 2020 during the COVID-19 is that the world can come to a standstill. And the main thing for us to avoid going to the future in terms of grounding to stand still, especially for the tourism and affecting the livelihoods of millions and billions of people depending on this sector, then there's pertinent question of how do we sustain ourselves beyond to the future? And that brings us to the aspect of being readiness and having a readiness plan. And most of what has been discussed in this conference is about how do we now lay the foundation so that when we are going to the future, we are more solid, we are more united, and we are thinking in one language. And we are taking everyone on board towards building this resilience. And those are the core cornerstone for us to achieving the future. A future without constraint and without disruption of the tourism the way we have seen in the last 3 years prior to this COVID-19 pandemic.
It's really interesting you use words like united and collaboration and working together. Tell me a little bit about sort of what that means in practice going forward.
Yeah, in practice is that before this pandemic, we have seen isolation. We saw when countries started reporting some few cases of COVID-19, other countries started closing, shutting down their borders, not knowing that we are interconnected. And none of us is living in an island of its own. So we are interconnected and we have to be one. And when I'm in travel, then I expect my next neighbor to support me to come out of this process. That is under the process of mitigation and resilience and recovering from the effects of the pandemic and epidemics. So what this means, having a united front entails that we collaborate. When you have some comparative advantage in terms of medical practice, in terms of tourism travel, in terms of media, like the media guys, you need to amplify the interventions which needs to be done. And that is what we are saying. All of us, all our different sectors does several things, but now we need to unite to bring all these various interventions together, whether it's in the tourism sector, whether it's in the medical sector, whether it's in the media, in all the aspects, so that when we unite our efforts, then we can have a resilient society, we can have a resilient world. That is what I mean about collaboration and having all the stakeholders together. And that's why in terms of emergencies, we talk about an all-society approach, responding in and ensuring that everyone is involved, even the vulnerable, even that community man down there. Thank you.
That's a great answer to my question. You're here in Jamaica, Caribbean, you've come from Africa. Tell me a little bit about some of the learnings that that you can benefit from the way the Caribbean and Jamaica responded in terms of resilience, and also perhaps how Africa responded that us here in the Caribbean could learn from.
I think one of the key things is that in the Caribbean, we have seen the power of union, of the 21 or 28 countries coming together, building this and coming up with this resilience center. And after when they came up with this resilience center, they now went outside to Africa, like to build a resilience center in Nairobi, in Kenyatta University. That is the Global Resilience Center for East Africa. So part of that is really something to buy in and something to go forward with. That based on the unity they have, based on that vision that we need to be resilient, they started this as a small vision, but it's now widening to the African continent and hopefully to other regions of the world to ensure that we walk the talk. We walk the talk in terms of ensuring that we are practical in terms of building that resilience that we are talking about. Yeah, thank you.
Thank you for joining us at Breaking Travel News here in Kingston, Jamaica. Thank you.
Okay, thank you so much. I appreciate. So my parting shot is, number one, when we are going to the future, pandemics is here to stay with us. So we need to ensure some key elements. Number one is all nations to strive towards building and strengthening mechanism, coordination mechanism. Having a plan, resilient plan, and testing that plan to ensure that whatever you have written in that plan is practically possible to implement it. Number two is scaling up matters of internal and external coordination. You need to internally coordinate your players. And then overally, you need to map other stakeholders who are of comparative advantage, who are with a public-private partnership, and ensure that they are on board. And then number three is in terms of public communication. How do we disseminate messages and to ensure that all the relevant stakeholders, even the vulnerable society of the society, in the tourism sector, in other sectors, are on board. And you read them using the real-time messages to prevent any disruption of travel, tourism, and ensuring that we minimize morbidity and mortality in case of a pandemic. And number four is about community engagement. How do we talk to one another? How do we leverage on the resources available to ensure that every community, every person, every stakeholder is working with us and they own the process? And finally, dynamic listening and rumor management. That is a very important thing, especially for the media. Whatever is circulated in the social media, before you click the button, is this information factual? And that is the main thing. So that at the end of the day, we don't become a trigger of amplifying misinformation, which is damaging to our tourism sector and other interventions. Thank you so much for having me.
Thank you, and we'll do our best to disseminate the right factual information going forward for you.
Absolutely, thank you, sir.